It's almost a universal experience, isn't it? That moment you're faced with something from the healthcare world, maybe an insurance explanation or a bill that just makes no sense at all.
Yeah, or medication instructions that feel like they're written in code.
Exactly. And you just feel completely lost, like you're in a maze. This incredibly complex system touches every single one of us, no matter our health or background.
It really does. Healthcare is so much more than just appointments and treatments. It's this sprawling, intricate web of policies, regulations, processes.
Right.
And that's actually what we're diving into today.
Yeah.
The sheer, often overwhelming complexity of the healthcare system and, crucially, how it impacts you, the individual.
Absolutely. And we've pulled together a really interesting set of sources for this deep dive.
Mm.
We're looking at articles that really dig into healthcare quality, those constant head scratchers like billing errors, some deep thinking on medical ethics, the role of accreditation bodies, those moments where health communication just kind of breaks down.
Yeah, those communication gaps.
And a particularly insightful piece that looks at complexity through multiple lenses: patients, lawmakers, doctors, and hospitals. Plus, there's an analysis connecting how patients feel about their care to a hospital's bottom line. Another fascinating layer.
Yeah, that one's interesting. So our goal today really is to try and cut through some of this noise and pull out the key insights. We want to understand the challenges baked into our current healthcare system and maybe explore potential ways we could make it more navigable.
And we're keeping our focus squarely on how all this intricacy plays out in your life, right?
Exactly, how it affects the individual.
Okay, let's unpack this then, starting with the people right at the center. The patients. It sounds like just trying to navigate this on a basic level is, well, a huge undertaking.
It truly is. From a patient's view, a major hurdle right off the bat is just understanding your insurance coverage. And then trying to make informed choices based on that. It's tough.
Like choosing a plan.
Yeah, think about Medicare, for instance. A typical person might face dozens of different plan options. Even just the Part D drug benefit can have nearly 24 choices.
Wow.
All with different premiums, different drug coverage lists. This complexity isn't just annoying, it can lead to real financial and health problems if you can't figure out how to access or understand the care you need.
That's just staggering. Dozens of options. And then you
Yeah.
need a certain level of, health literacy and numeracy to even start comparing them, right?
Precisely. And the research shows that a pretty significant chunk of U.S. adults lack the numeracy skills needed for, say, managing a household budget, let alone deciphering healthcare plan comparisons. And literacy is key to understanding the fine print, comparing info, drawing conclusions from really dense text. These are skills many people find challenging, and it often gets harder for folks over 60.
So even picking the right plan can feel like a gamble. And it doesn't sound like commercial insurance is any easier.
Not really, no. Choosing a commercial plan can be just as bewildering. You've got all these different networks, different coverage levels,
Right.
and the information about who's actually in the network, often unreliable. Studies have found big differences between who's listed and who actually participates.
Oh, great.
Yeah. So it's not uncommon for you to think you're at an in-network hospital, but then get hit with out-of-network charges because maybe one specific doctor who treated you wasn't in your plan.
That's the kind of surprise bill that makes people furious.
Yeah.
It's just maddening.
Totally. And it gets worse, unfortunately. We also saw stuff about people being denied care outright.
Denied care. Even with insurance.
Yes. Even within Medicare Advantage plans, which often sound pretty comprehensive, patients can face denials of care or suddenly lose coverage. And what's really striking is the appeal process.
Okay.
Well, the data shows a large percentage of denials are actually overturned when people appeal them, but hardly anyone appeals.
Really? Why not?
It seems like the complexity itself is the barrier. Only a tiny fraction of people who get denied ever file an appeal. So you've got this system where potentially wrong denials just stand. It suggests the process is too hard to navigate for the average person.
And it really brings it back to the listener, doesn't it? That feeling they're trying to avoid being overwhelmed is exactly what this complexity seems designed to create.
Yeah, it's a huge burden.
Okay, let's shift gears a bit. What about the people making the rules? The lawmakers. It sounds like they're also kind of wrestling with this monster.
They absolutely are. Regulations, both federal and state, are big contributors to how complicated healthcare is. That historical three-layered cake of Medicare and Medicaid, as it's called,
Uh-huh.
that set up fundamental divisions and variations state by state that we still live with. You've got federal rules, but then states administer things differently. They might do optional expansions. It creates this patchwork.
So inconsistency across state lines.
Right, and new regulations, even when they're meant to help, can sometimes just add more layers of complexity.
How does that happen? Like, can you give an example of a rule that backfires complexity-wise?
Sure. Sometimes you get these really specific laws trying to fix one tiny problem, but they end up creating weird exclusions, like the Medicare wait time for benefits.
Good.
There are exceptions for end-stage renal disease and ALS, but not for other conditions that might be just as urgent. It feels kind of arbitrary, you know?
Yeah.
And then on the flip side, you have really broad laws like the anti-kickback statute. It's meant to stop financial incentives from messing with healthcare decisions, which is good.
Right.
But it's so broad that they have to write tons of exceptions just so normal, beneficial things can happen without being penalized. Like a hospital offering a small discount for bundled services, technically a kickback.
So it needs an exception.
Well, I don't
It's
know.
like a constant balancing act.
Exactly, a tightrope walk.
Yeah.
And sometimes the fixes create new problems. Remember those unintended consequences our sources mentioned?
Yeah, tell me about those.
Well, take the funding cuts back in the 80s. The goal was probably cost control. But one result, a big jump in patient dumping.
Patient dumping. What's that?
Uninsured patients needing emergency care were basically transferred from private hospitals to public ones, often when they weren't stable.
Oh, wow.
That led directly to EMTALA, the Emergency Medical Treatment and Labor Act, to protect those patients.
So one action led to a reaction.
Precisely. Or the Medicaid drug rebate program meant to lower drug costs, but it initially hurt public hospitals financially. So then they had to create the 340B program to help offset that.
It's like dominoes.
It really is. And even recent fights over disproportionate share hospital payments, DSH payments.
For hospitals serving low-income patients.
Right. The legal battles over who gets them and how much they get just show how volatile and unpredictable funding is for these hospitals. Makes long-term planning almost impossible.
It just feels like every move in this system triggers a chain reaction, sometimes in totally unexpected directions.
Yeah.
Okay, now let's think about the doctors, the physicians on the front lines. How does all this complexity hit them day to day?
For physicians, a huge challenge is just the basic unpredictability of costs for their patients.
Right, you can't tell them how much something will cost.
Exactly. With all the different insurance models and the, frankly, terrible price transparency, it's nearly impossible for a doctor to say, this procedure will cost you X dollars, which makes those really important conversations about affordability incredibly difficult and stressful.
And it's not just about the money for the patient, is it? There's also this huge administrative load on the doctors themselves.
Oh, absolutely. Prior authorization, PA, and just the endless documentation requirements. It's a massive burden.
Prior authorization. Getting the insurance companies okay first.
Yeah. Healthcare teams spend hours, literally hours each week just chasing PAs, getting permission for treatments or meds. And that inevitably means delays in care for patients.
That must be so frustrating.
It is. Then you add in the mess of medication formularies. Those are the lists of drugs each insurance plan prefers to cover.
And they're different for every plan.
They can vary wildly. So a drug that's easy to get on one plan might be completely uncovered on another. It turns prescribing into this guessing game for doctors.
Yeah.
They're just trying to make sure patients can actually get and afford the medicine they need.
It sounds incredibly inefficient. They want to treat patients, not play bureaucratic games.
Exactly. And even when a medication gets approved, just ordering it in the electronic health record system can be surprisingly tricky.
How so?
Our sources gave examples where, like, a common drug might have dozens of different order options listed, and the right one, the one the insurance actually approved, might be hidden under some specific brand name with even more choices.
Oh my goodness. Sounds ripe for errors.
It is. And a huge waste of time. This complexity pops up with lab testing, too. Different insurance plans often prefer different labs for different tests. Yeah. So that's another administrative headache for the doctor's office. And it can lead to billing mistakes and higher costs for patients if they accidentally use the wrong lab according to their insurance.
So from the patient staring at a confusing bill to the doctor just trying to order a basic medication, complexity seems to be adding friction at every single step.
It really does permeate the whole system.
Okay, let's look at the hospitals now. How are they coping with all this intricacy?
Hospitals face their own set of pretty significant challenges from all this. Think about audit systems like the ones run by the Joint Commission.
Right, they accredit hospitals, check on quality and safety.
They do. And the goal is obviously important, but implementing and maintaining compliance with these systems can be incredibly complex and costly for hospitals.
And are the standards always helpful?
Well, that's the thing. Some of the standards themselves have been criticized for maybe lacking clear clinical value or strong scientific evidence. It's actually quite telling that the Joint Commission itself got rid of a bunch of these standards recently, acknowledging the burden they created.
Huh? Makes you wonder if some audits are more about bureaucracy than better care.
It's a valid question. Then there are those DSH payments again, the disproportionate share hospital funds.
Right, the ones for hospitals with lots of Medicare and uninsured patients.
The rules deciding which hospitals qualify and the formulas for calculating the payments are so unbelievably convoluted. They've led to years of lawsuits between hospitals and the government.
Creating massive financial uncertainty.
Exactly. For institutions often running on tight margins already, serving vulnerable people. And like we touched on, the sheer need for meticulous documentation and billing, it's vital for getting paid, but it pulls doctors and nurses away from patient care, reduces efficiency.
Yeah.
And finally, just the issue of billing errors themselves. It's a huge drain, costing Medicare billions every single year.
It really paints a picture of a system where patients, lawmakers, doctors, hospitals is just struggling under the weight of all this complexity.
That's a good way to put it.
Now, let's move to something that seems crucial for navigating this mess. Health communication. Sounds like another area where the system often falls short.
It absolutely is. Our sources really highlight how poor health communication, stemming from policy limits, institutional structures, language barriers, contributes significantly to worse access, lower quality care, and ultimately poorer health outcomes.
Especially for vulnerable groups.
Especially for them. People with limited literacy or language barriers suffer the most. And current policies often think just translating materials is enough to be linguistically appropriate.
But it's not just about the language, is it?
Not at all. That approach completely misses critical things like readability. Is the translated text actually easy to read? Are the word choices clear? Is it truly understandable for the person it's meant for?
So just translating a super complex medical document doesn't help if the person still can't understand the complex ideas or jargon in their own language.
Precisely. If the reading level is still way too high or it's full of technical terms, it's basically still inaccessible. And this ties directly into a fundamental patient right, the right to information.
Okay.
People have a right to understand their illness, the proposed treatments, the costs, in a way that actually makes sense to them. Transparency here isn't just nice to have, it's essential for informed decisions and building trust.
Beyond just information about their condition, what other key rights should patients know about as they try to navigate this system?
Well, our sources flagged several important ones. Things like the right to access your own medical records quickly, the right to get emergency care regardless of whether you can pay right then and there, the right to give informed consent before any treatment or test.
That's a big one.
Huge. Also, the right to confidentiality, the right to get a second opinion, transparency about hospital charges.
So you can actually see the prices.
Ideally, yes. And importantly, the right to non-discrimination, the right to safe, quality care, the right to choose alternatives if possible, like where you get meds or test the right to a proper referral, and specific protections if you join a clinical trial.
Wow, that's quite a list. Knowing these rights seems like the absolute first step for anyone trying to advocate for themselves.
It really is. Being aware is crucial.
Now, this next bit is really interesting. It looks at the financial side, specifically the impact of maybe less tangible things like patient experience and quality standards in hospitals.
Yeah, this is fascinating. There's growing evidence showing a pretty strong link between how patients feel about their care experience and how well the hospital does financially.
Really? How so?
A key study from Deloitte used HCA-HPS scores. That's HCA-HPS, usually called HCAHPS. They're those standard surveys asking patients about their hospital stay.
Right, I think I've gotten those.
Yeah. And this study found that hospitals getting consistently better patient experience scores also tended to do better financially.
That's surprising. You might think finances are just about patient volume or doing complex surgeries.
Those matter, sure. But this research showed hospitals with excellent patient ratings on those HCHPS surveys had significantly higher net profit margins compared to hospitals with low rating.
Wow. higher profits.
Yeah. And this connection held up even after they accounted for other things like hospital ownership type, location, the kinds of patients they serve. It really suggests a genuine direct link between patient experience and the bottom line.
So it's not just like happy patients tell their friends. There's a more immediate financial link. What's driving it?
Seems like a few things. Medicare's value-based purchasing program, VBP, definitely plays a role. It gives financial rewards to hospitals with better patient experience and quality.
Okay, so there's an incentive there.
Right. Although the study said VBP alone doesn't explain the whole financial difference, what seems really key is staff engagement. Things like the quality of the staff, how well they communicate, how responsive they are to patient needs. When staff are engaged and giving good patient-centered care, patients are happier. And that, maybe surprisingly, seems to directly boost the hospital's financial health.
Yeah.
The data really argues that focusing on the human side isn't just the right thing to do, it's actually good business in healthcare. It impacts the bottom line.
That makes a lot of sense, actually. But the sources also mentioned there's some debate about these patient experience measures themselves, right? Like, how valuable are they really?
That's a really critical point to bring up. While everyone pretty much agrees patient experience is important, there are valid concerns about how we measure it and what those scores truly tell us.
Because it's subjective.
Exactly. It's inherently subjective. Your perception of your stay could be influenced by all sorts of things, not directly tied to the clinical quality of care you got.
Mm-hmm.
And there's a worry that focusing too much on hitting high satisfaction scores could lead to unintended consequences. Like maybe doctors hesitating to give bad news or ordering unnecessary tests just to please a patient, or hospitals spending money on fancy lobbies instead of core clinical improvements.
Right, focusing on superficial stuff instead of outcomes.
Potentially. So it's definitely a complex issue. There are good arguments on both sides about the value and limitations of these patient-reported measures.
It feels like we've covered a massive amount of ground today. We've really seen how tangled and, well, complex this healthcare system is. So as we start to wrap up this deep dive, what are the most critical takeaways you see from all this?
I think the biggest theme is just how interconnected everything is. The complexity we talked about, it directly impacts patients trying to navigate the system.
Right.
It shapes how effective regulations are and their unintended side effects. It puts a huge burden on doctors and hospitals. It gets in the way of clear communication. It affects whether people can exercise their rights.
And it even hits the finances, linking back to patient experience and quality standards.
Exactly. Ultimately, this pervasive complexity hurts pretty much everyone involved. The person seeking care, the lawmaker trying to regulate, the doctor providing care, the hospital delivering it.
And the sources really drive home the idea that managing this complexity isn't just about convenience, is it? It's fundamental to creating a system that's fairer, more adaptable, and more equitable.
Precisely. We really need to find ways to streamline things, improve transparency across the board, boost communication clarity between everyone, and make sure the system is actually designed to serve people's needs, not overwhelm them with just sheer intricacy.
So for you, our listener, as you think about all this, what specific part of this healthcare complexity feels most concerning to you, or maybe most in need of change? And what kind of solutions, even small ones, might start to tackle that specific area? It's obviously a huge challenge, but understanding the different pieces like we tried to do today feels like the essential first step towards finding real improvements.
Yeah, and maybe a final thought to leave you with. Think about how sometimes trying to fix one part of healthcare, maybe costs, or regulations or quality, can accidentally make things more complex somewhere else.
That interconnectedness again.
Right. Recognizing those subtle knock-on effects is really vital if we want to make real sustainable progress towards a system that actually works better for patients.
Well, thank you for taking this deep dive into healthcare complexity with us. We really hope this exploration has given you a clearer foundation for understanding the huge challenges, but also maybe some of the opportunities for improvement within this absolutely vital system.
Yeah, we hope it sparks some thinking.
We definitely encourage you to keep reflecting on this and maybe consider what other questions or areas you'd want to explore further on this topic.
And please know that our future deep dives will keep unpacking important, often complex parts of the world around us, always trying to bring you clarity, insight, and a more informed perspective.